Hello and welcome! Today, we're diving into a very important topic for anyone over 70, or those with elderly loved ones. Medical checkups are meant to keep us safe and healthy. But did you know that some common tests may actually do more harm than good as we age? What I'm about to tell you, you probably won't hear from your doctor, especially if you're over 70. Some medical tests you might think are life-saving could actually be putting you at risk. Today, we'll reveal the 5 most dangerous and overused checkups that could do more harm than good. Let's get started. Checkup number 5. PSA tests. The hidden trap of prostate cancer screening. You won't hear this from your doctor, but PSA testing after 70 might not be saving lives. It might be creating fear, surgeries, and side effects instead. PSA stands for prostate-specific antigen, a protein produced by the prostate. A simple blood test measures the levels, and high numbers may suggest cancer. Sounds helpful, right? But according to the U.S. Preventive Services Task Force, routine PSA screening is not recommended for men over 70, and even discouraged for those in their 60s unless they're at high risk. Why? Because many prostate cancers in older men grow so slowly they'll never cause symptoms, pain, or death. Yet, once cancer is detected, it often sets off a chain reaction: biopsies, surgeries, radiation, and serious side effects. Meet Frank. Frank was 74, retired, and loving life on the golf course. He had no symptoms, no pain, no urinary problems, but during a routine checkup, his doctor suggested a PSA blood test, just to be safe. The result? Slightly elevated. Just enough to worry his doctor. Frank was referred to a urologist, then sent for a biopsy. It was painful and left him with blood in his urine for days. The diagnosis? A slow-growing tumor, so slow that doctors admitted it might never affect his life. But the word cancer haunted him. He chose surgery. Afterward, he struggled with incontinence and lost sexual function. Frank wasn't angry, but he did ask, "What if I had never done that test?" Checkup number 4. EKGs for low-risk patients. Here's something no one tells you. An EKG might make you sicker. Electrocardiograms, or EKGs, are painless heart tests used to measure electrical signals in your heart. But if you're healthy, symptom-free, and not at high risk for heart disease, the test might lead you down a dangerous road. A 2021 study in JAMA Internal Medicine showed that routine EKGs in older adults with no symptoms resulted in a massive number of false alarms, leading to stress tests, invasive heart procedures, and even unnecessary surgeries. Now let's talk about Linda. Linda was 77, active, and never had any chest pain or shortness of breath. But during a senior wellness visit, her clinic offered a free EKG screening. Just routine, they said. The EKG showed a minor irregularity, so she was sent for a stress test, then a CT angiogram, then a catheterization. Her doctors didn't find any serious blockages, but after the procedure, she developed a blood clot in her leg, was hospitalized for 3 days, and left with nerve pain that lasted months. She later asked, "Would I have been better off never knowing anything was wrong?" Checkup number 3. Bone density tests for everyone. Osteoporosis screening sounds harmless, even helpful. But here's a fact you won't hear often. For many older adults, especially those without symptoms or risk factors, bone scans can be misleading. The most common scan, the DEXA test, checks your bone density. But once a low score is recorded, many doctors rush to prescribe medication, often bisphosphonates like Fosamax or Boniva. These drugs can help in some cases, but they also come with risks: jaw decay, esophageal irritation, and rare but severe thigh fractures. Here's Margaret's story. Margaret was 79 and healthy. She lived alone, walked every day, and had never had a fracture. But her doctor recommended a bone scan, annoyed, just to be sure. Her results came back with low bone mass. She was prescribed a bisphosphonate immediately. A few months later, she started experiencing sharp jaw pain, and after a visit to the dentist, it was discovered she had osteonecrosis, bone death in her jaw. She stopped the medication, but the pain never fully went away, and she'd never even had a fracture in her life. Checkup number 2. Colonoscopy. Not always the golden standard. You might be surprised by this one. Colonoscopy is one of the most respected screening tools in medicine, but after age 75, the risks may outweigh the benefits. Colonoscopy requires intense preparation, strong laxatives, fasting, and sedation. In older adults, that prep can cause dehydration, kidney stress, and dizziness. The procedure itself carries risks of perforation, bleeding, and adverse reactions to anesthesia. A massive 2019 study of 1.3 million Medicare patients found that after age 75, colonoscopies saved only 2 lives per 1,000 screenings, but caused over 20 serious complications. Now meet Dana. Dana was 73, a proud grandmother and owner of a family bakery. She had no symptoms, no bleeding, no changes in bowel habits, and a history of clean colonoscopies. But her new doctor insisted she get screened again. She agreed. During the procedure, a small polyp was removed. That night, Dana woke up with severe abdominal pain and collapsed. At the ER, they diagnosed a bowel perforation. She spent 9 days in the hospital, lost 10 pounds, and had lingering pain for months. The worst part? Her previous screenings had already shown no signs of trouble. This one wasn't necessary. Checkup number 1. Full-body CT scans. More radiation, more harm. You've probably seen the ads. Get your full-body scan today, prevent cancer tomorrow. But here's the truth. Full-body CT scans for healthy seniors are one of the most dangerous trends in modern medicine. Each scan exposes your body to 10 to 20 millisieverts of radiation, the equivalent of up to 500 chest X-rays. A 2023 study in JAMA Internal Medicine found that increased CT scan use could account for up to 5% of all cancers in the U.S. Here's Marcus's story. Marcus was 80, full of energy, and still teaching martial arts classes. During an elite health checkup at a private clinic, they suggested a full-body CT scan. Just a precaution, they said. The scan showed a tiny lung nodule, just 3 millimeters, but that tiny dot triggered a full-blown panic. He was sent for a PET scan, then a biopsy. The biopsy collapsed part of his lung. He spent weeks recovering with chest pain and shortness of breath that lingered. The result? The nodule was benign, no treatment needed. The entire ordeal had been unnecessary. So there you have it. 5 screenings that sound helpful, but can actually lead to pain, stress, or harm when done without clear need, especially after 70. We're not saying to skip all tests. We're saying ask better questions. What happens if this test finds something? Will it actually change how we treat you? What are the chances of false alarms? And always ask, is this test for me or for the system? Remember, real prevention starts with lifestyle. Eat well, move daily, sleep deeply, and make decisions based on facts, not fear. If you've ever gone through a test that turned out to be unnecessary, or worse, harmful, share your story in the comments. Let's make this information impossible to ignore.